So the quiz does not include the fetal circulation we're going to talk about, all right? But it does include all the veins, including the lower extremity, because we didn't do the quiz on the lower extremity arteries. And except for superficial, they're essentially the same. How many case studies do we have? Just the one? Two? Two total ones, or you all take them? Okay. Because I totally forgot about them in the morning, so I want to make sure we have time for them. I gave them too long on their quiz. It took like 20 minutes to take the quiz. So we'll do fetal circulation. That'll take me about half an hour, a little less. And then about an hour to an hour and 15 minutes lab time. I'll kind of check in with you and see how you do. And then we'll take the vein quiz, all right? And then I'll lecture for about an hour, 50 minutes to an hour on blood pressure. Kind of synthesize everything that's in your lecture notes on blood pressure, hormone-wise, and simplify a little bit on that. And then we'll do case study, and the rest of it is your time to do pulse and blood pressure lab. Okay? So our lab exam on Thursday, if you haven't noticed, is shorter. It's worth 60 points, so it'll be about 44 or 46 questions, and then I kind of proportion it. Our next lab exam on blood cells and immune system is even shorter. It's about 28 questions. So proportionately, Thursday's question will be equal to 60 points, and our next lab exam is equal to 40, so the two together equal 100 points. So we'll have two shorter lab exams, okay? And we do have lecture on Thursday. If you didn't notice it in your schedule, we'll get started on blood cells, all right? So we can do that a little bit better with having the shorter lab exam. All right, so let's look at fetal circulation. And we've covered some of these structures already, but I want to kind of tie them all together and look at the sequence. So let me kind of go through on the diagram, and then I'll draw it on the board, and then I actually have it animated. So with fetal circulation, the left ventricle is going to be pumping blood out of the left heart to the aorta. And you'll notice that it's not quite red. It's more purple or mauve than it is red because it's not as high in oxygen content as it is post-birth, all right? It works fine for the baby because, as we'll see in the respiratory system, fetal hemoglobin has a higher affinity for oxygen and can hold on to it a little bit better and carry a little bit more that way. Anyway, it goes down the thoracic aorta, the abdominal aorta, and out the common iliac veins, and I'll write these in sequence for you. Then into the internal iliac arteries, down into the pelvis. From there, from a branch that goes to the bladder, we see the two umbilical arteries, which come up the interior aspect of the abdominal wall to the belly button, your umbilicus, and go out the umbilical cord to the placenta, where in the chorionic villi they pick up oxygen and nutrients, return via the umbilical vein through the umbilical cord to the liver. So this is a situation similar after birth to the pulmonary arteries and veins, where the pulmonary arteries were low in oxygen, carrying blood away from the heart under high pressure, hence we call them arteries, pick up oxygen in the lungs and return that blood under low pressure to the heart, and hence we call them veins. So we have deoxygenated pulmonary arteries and oxygenated pulmonary veins, all right? In the fetus, we have relatively deoxygenated umbilical arteries and oxygenated single umbilical vein for the same reason. It's called a vein because it's returning blood to the fetal heart, but it's oxygenated. And we call it a vein, though, because it's returning blood to the heart and is under low pressure. All right, now, notice where that blood goes. It doesn't go directly to the inferior vena cava and to the heart, but it goes to the liver first. What do we have in the umbilical vein? What has it picked up from the placenta? Two main types of material.
Nutrients and oxygen.
Nutrients and oxygen. What does that remind you of what we discussed on Thursday? Vessel or vessels carries nutrient and oxygen to the liver in the adult? Hepatic portal, is that going to carry oxygen or nutrients? Or both? Nutrients. What carries oxygen? To the liver. The branch of the celiac trunk. Common hepatic artery. Okay? So after birth, it takes two vessels, flowing in tandem with the blood flow going in the same direction, but doing the same thing as the umbilical vein, carrying oxygenated blood and nutrients to the liver. So even in the fetus, it gets first dibs at those nutrients. All right? So it goes to the liver. Some of it will go through the liver sinusoids, but not all of it needs to do that. So it has the option of bypassing the liver tissue and going directly to the inferior vena cava. And then it goes into the fetal heart, okay, completing the circuit. So let's diagram that, or I'll diagram it. You can copy it on the board. We'll put the fetal heart. I made the mistake this morning of putting the fetal heart too low, and then I had to draw my liver over on the side. Didn't have room for it. So we'll have the superior vena cava and inferior vena cava and pulmonary trunk. You draw a little bit lower. How about I draw the top part first? I'm needing my connection between the pulmonary artery and the aorta here. So blood coming out of the fetal heart, I'm going to draw purple because it's not really red yet. It's still got oxygen in it. You could draw it kind of reddish purple if you want to, but I don't have that color. And then the abdominal aorta, it continues down. Let's see if I have enough for liver. I think that's enough for liver. And then it's going to branch and form common iliac arteries. All right, so this is fetal, before you forget. Fetal circulation. So blood exiting the fetal heart is going to exit via the ascending aorta to the arch of the aorta, or aortic arch. And then it's going to enter the thoracic aorta. And finally, the abdominal aorta. And then it will travel, the abdominal aorta ends by forming the common iliac arteries. All right, so I think you know the aortic components. I'll label this. So we have the common iliac artery, and diving down into the pelvis from each common iliac artery is the internal iliac artery. So that's what blood flow on its way to the placenta will enter next. And one of the branches off of the internal iliac artery that I didn't assign to you to learn is a branch that goes to the fetal bladder. Well, even in the adult. It's called the superior vesicular artery. All right? In a tracing pathway, I would give that to you because it's not one of the ones that I assigned to you. But a branch off of the internal iliac artery is the superior vesicular. So I'm going to write that in a different color just because it's not one that you have to know. And then branching from the superior vesicular, we have the umbilical arteries. So that's what we see right here. All right, we would have the umbilical arteries, a pair of them, and they are going to pass out of the fetus at the belly button, at the umbilicus, and they are going to enter into the umbilical cord. So these are still going away from the heart. So they are arteries, not veins. So in our tracing pattern, the next vessel would be one of the umbilical arteries. And then they would reach the surface of the placenta and send branches down into the chorionic villi. And they would lose their smooth muscle wall and form capillaries. And within the placenta, they would pick up the nutrients from the mother and the oxygen and would return to the umbilical cord as a single umbilical vein. Even though it's oxygenated, blood flow is now flowing back to the fetal heart under low pressure, lower than the arteries, and so it is a vein rather than an artery. So we would have placenta here, and then umbilical vein. Right? It travels just deep to the abdominal wall, up towards the liver. And I didn't give myself much more room here. And as the umbilical vein, it passes to the liver, all right? Now, at the liver, it can either send blood out to the liver, or it can bypass the liver tissue and directly enter into the inferior vena cava. So I know I've got some distance here. This would actually be over here, but the inferior vena cava is going to be carrying deoxygenated blood from the abdominal cavity in the lower extremities, but it's going to pick up all this oxygen that's coming in from the umbilical vein. And so it's really going to be oxygenated blood coming up into the liver. I'm sorry, the heart.
Can you repeat that, please?
So oxygenated blood is going to be coming back into the fetus. It's going to pass up to the liver as the umbilical vein. And some of it will go to the liver, but some of it will bypass the liver in this structure known as the ductus venosus. And then it will enter the inferior vena cava. Blood from the lower extremities in the abdominal content of the inferior vena cava is deoxygenated. But it's going to become oxygenated with all this blood coming in from the placenta. So the inferior vena cava going into the heart is actually carrying primary oxygenated blood.
Yeah, what I was wondering is if the vein that is traveling from the placenta is carrying oxygenated blood, is the reason why it's called a vein because it's traveling to the heart? Is that
And it's under low pressure, so it has the structure.
So it doesn't
of a
matter
vein.
if it's carrying oxygenated blood or not?
It's like the pulmonary veins coming back to the left atrium. They're oxygenated after birth. But again, they're under low pressure, so we call it, because they're carrying blood back to the heart, So we call them veins because of their structure rather than their content. Okay? So now, as the blood from the inferior vena cava enters the right atrium, it does so at such a high flow and at a direction that most of this goes right through the foraminal valley to the left side of the heart. All right? So it's going to come in this fashion. Go right through the foraminal valley. Let's come over here. Umbilical vein in the liver is going to bypass most of the liver tissue. I mean, some of it will go through the liver, but a lot of it will bypass the liver tissue via a vessel known as the ductus venosus. And I'll show it to you on our bottles here in just a moment. So that's what allows it to bypass the liver, is that ductus venosus. And that's this vessel right here. Okay? Connecting umbilical vein to the inferior vena cava, but within the liver itself, or just at least on the edge of it. So now this picture shows the normal blood flow, the oxygenated blood on the right side, oxygenated blood on the left side. But if you look over here, the right is reversed. The right atrium and right ventricle pulmonary trunk are oxygenated, more so even than the left side. All right, so in fetal life, the right atrium and ventricle are considered to contain oxygenated blood, because that's where the blood is coming to first from the placenta. The left atrium does have some of the oxygenated blood, but it has deoxygenated blood from the pulmonary system as well. So we're essentially getting a mixed flow here. So some of this blood will flow along with deoxygenated blood from the superior vena cava. Some of this blood will flow into the right ventricle. So I'm only going to color it purple here, but it's still considered to be oxygenated blood. And it will go to the lungs and back. And the left side will end up being mixed and will go out the heart. So it can go through the foraminal valley. And even if it does go to the lung, it can go up through the ductus arteriosus and bypass the lung as well. We discussed those structures when we looked at the fossa ovalis and the ligamentum arteriosum. Okay? So I'm going to
Professor,
Yeah.
would you mind tracing that blue to the purple line one more time?
I will, but let me do this first. All right, so we start out with the aorta, and we have oxygenated, kind of a mixture, but more oxygenated than not, blood leaving the left ventricle going into the aorta, and coming down the aorta to the common iliacs. From there, it goes into the internal iliacs, the superior vesicular artery, and from that we have the two umbilical arteries carrying deoxygenated blood. It still is relatively high because it's coming off of the aorta. It hasn't gone to any tissues. But in comparison to the umbilical vein, we consider it to be deoxygenated. It then goes to the placenta and picks up oxygen and returns to the fetus via the single umbilical vein. As the umbilical vein, it enters the liver, and part of it will go through liver tissue to deliver nutrients to the liver's function. The rest of it will pass through this structure right here, which is the ductus venosus. There it will join deoxygenated blood from the rest of the lower extremities in the abdomen and enter the inferior vena cava to the right atrium. Most of that will flow right through the foraminal valley into the left atrium and into the left ventricle and out the heart again. Some of it will join deoxygenated blood from the superior vena cava, flow into the right ventricle, out the pulmonary trunk to deliver oxygen to the lungs. Not to pick up oxygen, but in the fetus to deliver oxygen. But we have the ductus arteriosus, in which some of that can still bypass the lungs and go into the aorta. Okay. So if you were to trace a drop of blood to the placenta and back, this is the vessels that I have over here on the right that you would pass through. So the various components of the aorta, common iliac to internal iliac to the superior vesicular artery. I put that in purple because if I gave you a tracing question that included this pathway, I would give you that part. It wasn't one that I asked you to learn, so I would give that to you. And then from the vesicular artery, we have the umbilical arteries to the placenta. You don't have to trace it through the capillaries and all of that and back again. Then we form the umbilical vein, via ductus venosus to inferior vena cava and back to the heart. Okay? Yes.
So technically the lungs get only a little bit of oxygen because most
They
of
get
it-
enough blood supply to supply oxygen to their metabolic needs, but they don't need to get all of it because they're not providing anything to the blood. They're only taking from it. So we don't have to waste time by sending all of the blood to the lungs like we do after birth. Okay. Now, I want to take the fetal structures that change and blood no longer flows through them after birth, and we change their name. Okay, so I'm going to write a column of both of those structures over here on the left-hand side of the diagram. So the first one is the umbilical arteries. So in the fetus, it's known as the umbilical artery. In the adult, blood is no longer flowing through that. So it forms a collapsed structure. And on this model here, you can see 3 different structures. One is single, 2 are paired. Right in the middle, this is representing the collapsed opening of the bladder to the amniotic cavity. And with development and the longitudinal folding, this seals off, and this becomes the most central structure, or the median umbilical ligament. You don't need to know that one, okay? But it's in the most center, so we use the term median. These blood vessels out here are branches of the external iliac, and they're supplying the abdominal wall. And along with their peritoneal covering, they're called the lateral umbilical ligament. Those you don't have to know either. Between the two, we have the medial umbilical ligaments. And these are the collapsed umbilical arteries. So they are on either side of the median. All right, so that's the bladder, but these are the 2 collapsed umbilical arteries that are going to go out the umbilicus. So the adult structure, after the baby is born, the umbilical arteries become the median umbilical ligament. That's these structures right here. Become the median umbilical ligament after the baby is born and umbilical cord is clasped.
Sorry.
I say median. I'm sorry. Okay. Thank you after making a big deal out of it. Thank you, Karen. All right. So then it goes to the placenta and it comes back. So that's below the umbilicus. From the umbilicus upward, we have the umbilical vein. And, excuse me, after birth, that of course no longer has blood flowing through it, so it forms a collapsed vessel. And that is known as the ligamentum teres. Teres means round ligament. Why in the female reproductive system we use the word round ligament, but for this we use ligamentum teres, I don't know. But we do. And you can see it on the liver model. This is a huge liver. I would be really sick if my liver was this big. But coming up from the umbilical cord, the umbilical vein forms this ligamentum teres. And you can see that it's coming to the same region where we have the portal vein and the hepatic artery. So if this was the umbilical vein, it'd be going into the liver at the same point. Once the baby is born, it's collapsed, and this then is called the ligamentum teres. Okay? The ligamentum teres is collapsed umbilical vein. Now, the ductus venosus is also collapsed after the baby is born. This is a little bit easier. And that's going to carry blood around the liver, so it's not in use. So here we have the ligamentum venosum, bypassing the liver tissue, this white band of tissue, and going directly to the inferior vena cava. Okay, so that would be the collapsed ductus venosus, is known as the ligamentum venosum. The other two you already know. Blood no longer flows through the foramen ovale when our pressure relationships with the lung change. And so the foramen ovale becomes the fossa ovalis. And as well, our ductus arteriosus closes. And becomes the ligamentum arteriosum. Oops. Okay. And that's that cord-like structure that we can see with our hearts, connecting primary, the left pulmonary artery with the arch of the aorta, so right here. So after birth, it's called the ligamentum arteriosum. Before birth, it's open, and it's the ductus arteriosus. So those are the 5 structures that were patent in the fetus and closed after birth, change of pressures. Okay, that's fetal circulation. So why don't you take an hour and 15 minutes. I'll check with see how you are. And the quiz, I have 7 questions, so you get to miss 2 and still get a 10 out of 10. Not a perfect paper, but 10 out of 10. And then we'll do blood pressure.